And now on the line with us, we have Dr. Quazi Monirul Islam, who is the acting of WHO or World Health Organization representative to Thailand. Sawasdee ka. Good evening.
Sawasdee ka.
Good evening. Welcome to ASEAN Business Report. Could you please tell us that what are the risks of the bird flu epidemic in Southeast Asia now that there have been some incidences in China and also in Vietnam and Cambodia?
The problem or the danger of bird flu coming to Southeast Asia spreading is not that great. However, we need to be very careful and vigilant because we need to make sure that our surveillance system is okay, because some of the Southeast Asian countries' surveillance system is not as good as China or Vietnam or Thailand. So therefore, we need to be careful and carefully monitor the situation, what's happening. So I would say the danger at this moment is not that great, but however, it can become, because most of the cases what we have seen is so far in one part of China of H7N1. So the main point is we need to be careful and vigilant and strengthen our monitoring system.
Now, there is two virus strains reported, the H7N9 and the more common one, the earlier one, was H5N1. Can you explain in layman term of the differences of those viruses?
Okay, these are the viruses which commonly occur into the animals like pigs or chickens or birds, right? These are there already. However, we haven't seen before that this virus transmitting or migrating to the human being. Now, H5N1, which is an influenza virus of the animal, but it also the chickens, they will kill them. They also die. And it also migrates to the human being, and the case fatality is also very high. But H7N9, we haven't seen it before. And it's also now, we have seen now it's migrating to the human being. Unfortunately, when this virus is existing in the poultry or pigeons or animal, they do not suffer, they do not die. So that's why we are having problem with H5N1. We could diagnose, we could say that the poultry are dying, the chickens are dying, so that we could monitor. However, with this H7N9, animals are not affected, and therefore monitoring becoming a huge issue, right? But case fatality of H7N9 is also very high, because you have just said out of 21 cases what we have detected so far, 9 died. So that's the difference. These are the viruses existing with the animal group, but we have started seeing that they are migrating to the human being with a very deadly consequences.
Wow.
What about what should the Thai government do for prevention measures against this bird flu?
I think we should be very happy because Thai government has over the years established a unique surveillance system cooperating between the health and also animal sector. And so they have a unique system of monitoring what is really happening. Now, H5N1 virus is not really, they have tested it and it's not existent in Thai animal, in poultry. And also H7N9 is also not existing in various animals, right? However, Thailand is really closely monitoring that. Simultaneously, they are preparing for any consequences, right? They're making sure that diagnosis is there. We can diagnose it quickly. The sign symptoms, people started knowing the sign symptoms. They're telling the population also if you see unusual death of the poultry are immediately informed and they're being checked. And also making sure that if in any case it happens, pandemic, they're prepared for vaccines and also the treatment and management. So they are looking at it in various fronts. So I must say, in that way, we are in a unique situation where Thailand government is prepared for this.
Right, right. Now, on the regional picture with the World Health Organization, what measures has been taken to deal with the matter?
Over the matter, so what we are looking at in WHO, we are closely monitoring how the virus is behaving.
Right.
We are closely monitoring that contact to see whether there is any human-to-human transmission. If there is a human-to-human transmission, there will be probability of a pandemic that will have cause a havoc. So we are closely monitoring that. Simultaneously, we are now looking at the virus, helping countries through our 10 collaborating centers to develop the diagnostic facilities. At the same time, also looking at the possibility of vaccine. Right? So those are the various sectors WHO is working with the member states to help the countries to establish their preparedness.
Right. Without the purpose to cause any panic, sir, but from your assessment, how would you rate the threat of the virus epidemic right now?
Looking at the virus, because we don't know, there is no transmission from human to the human, how it's migrating, what's behavior, we don't know. So I would say danger doesn't look that high, but we need to be very, very careful. If there is, it changes, it mutates the virus, it can be a big problem, public health problem. So I said at this moment, prepare yourself, be vigilant, improve your surveillance system, be prepared, so that any consequence for any situation we are ready.
Okay. Thank you very much for joining us tonight.
Thank you very much.